Hi everybody, Dr. McMorris here, and today I'm here with Dr. Memark, and we're here to talk about what's going on, all things COVID related here in Cobb County. So Dr. Memark, just briefly update us on what's going on in Cobb, and then I'll kind of share with our employees what we're going to be doing here countywide within our organization.
Yeah, so I've been making the rounds with Ross Cavett and as many people as I can, because we are now facing this fourth surge, which is the Delta variant surge. And what we're seeing right now is, we've been on this upward trajectory now. We're into the second month of this, and it just does not seem to be going away at this point. And so what we're seeing is, remember that magic number, the 100 per 100,000, which is kind of the threshold for high community transmission. Well, we blew past that, and now we're at, I think last night was 649 cases per 100,000. So that shows us that we have very, very substantial community transmission that's happening. It's unabated, and it just is, just rolling along right now. And so the problem that we're seeing right now is that the hospitalizations have just been on that same trajectory. And so remember, we'll have a lag after you start seeing cases. You'll see hospitalizations, and you'll start seeing deaths. So we've been lucky, I think, that we've vaccinated most of our elderly populations, and so that they have some protection. So we're not seeing as many people die as we did in I think it was the second surge. But right now we're seeing younger folks that are being hospitalized, and hospitalization numbers just continue to rise. And because of the national shortage of nurses and staff, this is becoming an issue. So, the hospitals have requested emergency staff already from the state, and they're trying to get those together. But we continue to see hospitals that are critically low on critical care beds and medical surgical beds. So the concern is, if something else happens that's even non-COVID related, will the hospital be able to take care of everybody that needs the help at that time? And so this is why we're kind of raising our alarms and saying, all right, folks, we all need to pitch in to bring this down.
Sure. Thank you, Dr. Memark, for sharing that. And as a result of what's going on nationwide, within our region, and of course here in Cobb, we've had to make some tough decisions about what are we going to do right here at Cobb County government. So effective this Friday, August 20th, all employees, contractors, vendors, and visitors to our Cobb County facilities will be required to wear a mask or a face covering upon entering our facilities, and particularly when you cannot socially distance with those with whom you're meeting. So as we did before, we're asking, in spaces where you can't socially distance or common areas, to include break rooms, elevators, or lobbies, or small conference rooms, I'm going to ask you to mask up again. And if you don't have a mask for the public or even our employees, we will provide a mask for you. Those facilities that are outdoors are excluded from the mask mandate, such as our parks and our amphitheaters. We never removed our thermal scanners from our entrance of our facilities, so if you feel compelled to have your temperature taken as you enter our facilities, please do that. If you're feeling ill or have COVID-related symptoms, Dr. Memark, you also ask that we stay home, right? Because we're just not sure, and particularly if we're going into our fall season and into the winter, where we're more likely to spread germs and to get ill. Just don't take the chance. We will provide as much information as possible with regard to COVID protocols on our website. So if you come in contact with someone who has been exposed or diagnosed with COVID-19, we will make sure that we have guidance for you on our website, on our iCobb page. As part of our Cobb County family, I continue to implore you to do what is right, do what is best for our family. As I always reiterate, we sometimes spend more time with each other than we do our biological families, so we need to take care of each other. Thank you for all that you do. Thank you for your patience and your continued support as we push through this new terrain of COVID-19. We're here for you. Thank you.